According to Fidelity, a single person retiring at age 65 in 2025 will need $172,500 for healthcare costs throughout their retirement. But wait, there's more, because that number does not include long-term care at the end of your life that could cost anywhere between $50,000 to $120,000 a year. And this is a huge problem because most boomers are already entering retirement on razor-thin margins. The median boomer has $200,000 saved for retirement. And when you add on Social Security, that is about $2,600 a month. And that amount is not only supposed to cover all your living expenses, but also Medicare premiums, prescription drugs, out-of-pocket costs, dental work, hearing aids, mobility equipment, and much, much more. The math just does not work. Many boomers are entering retirement already unprepared financially and dealing with chronic conditions, and over the next 20 to 30 years, they will be stretched thinner as healthcare costs climb and their resources slowly disappear. They are facing a healthcare crisis with limited savings, high medical needs, and a system that wasn't designed for 20 to 30-year retirements. And in this video, I want to talk about this crisis, how retirement was originally designed, how the system changed over time, and what this means for the average boomer. Now, to make sense of this crisis, we first need to understand the retirement model that this country was built on, Chapter 1, when retirement was short and simple. Oftentimes when we look back at past generations, we act as if retirement worked better than it does today, and maybe to some extent it did. But that was because retirement looked nothing like it does today. You see, the modern image of retirement that we have comes from the 1960s, where you worked for 45 years until you were 65, and retired for 5 to 10 years as the life expectancy was 70. And for this short retirement window, you had Social Security, a pension, and some personal savings to live comfortably, and some might have even had employer-sponsored healthcare plans. Retirement was short, and what made it short was that healthcare was nowhere near as advanced as it is today. People didn't manage chronic diseases for decades, they didn't get life-saving surgeries, and they weren't taking dozens of medications. Instead, by your 70s, if your body started to deteriorate, you just died because there wasn't the advanced technology that we have today that is keeping many sick people alive. However, it wasn't just simpler healthcare that made life shorter, but many seniors in the past had no access to healthcare. In fact, prior to 1965, half of Americans over 65 had no health insurance. Insurance companies wouldn't insure them because they were too risky and expensive. However, to solve this problem, on July 30th of 1965, President Lyndon B. Johnson signed Medicare into law that consisted of two parts. Part A, that covered hospital insurance, and Part B, that covered medical insurance. And in the world it was created in, this system worked pretty well because retirements were short and needs were limited. However, nowadays, we're facing a completely different reality. And let's talk about that in Chapter 2, a longer, sicker, and broker retirement. So that was the old system of retirement. The new system of retirement looks very similar. However, there's just one tiny difference. You see, people are still planning on working for 45 years, but now they're planning on retiring for 20 to 30 years. And unlike before, many people aren't getting pensions, their personal savings are low, and employer-sponsored retirement healthcare is non-existent. So that's a 15 to 20 year longer retirement with less financial resources. And if that weren't bad enough, more people are entering retirement with more chronic conditions than ever, like diabetes, heart disease, and mobility problems, which means more doctor's visits, more tests, and more medication. So basically, people are entering a longer, sicker, and broker retirement, and what's driving this is modern medicine. Medicine that didn't exist 20 years ago is now keeping people alive for decades. MRIs, joint replacements, pacemakers, heart surgery, cancer drugs, and dozens of life-extending procedures. And while these breakthroughs are incredible, they come with a hefty price. The longer medicine keeps us alive, the more care we need, and then the more money it takes to stay alive. And this is the moment where many people think that Medicare steps in to fix everything. But Medicare was never designed to treat decades of chronic illnesses in 20-year retirements. But most people don't realize that until it's too late. Chapter 3, the Medicare myth. For millions of retirees, Medicare seems like this finish line where healthcare becomes simple and affordable. But instead, it often becomes the moment when people realize just how fragile their retirement is. Medicare was never designed for the world that we live in today. As I said earlier, it was created in 1965, when the life expectancy was 70 and medical care was very simple. And it consisted of two parts. Part A of hospital insurance and Part B is medical insurance. But it doesn't cover things like dental care, hearing, vision, and long-term care. For those things, you have to pay out of pocket or get supplemental coverage. There's a big gap in the things that it does not cover. However, for things it does cover, it's not this free socialized health insurance for seniors, but it can actually eat away a lot of your retirement income. The average monthly premium for Medicare is $185. If you want Part D or prescription drug coverage, it will cost you another $40 a month. And if you want Medigap, which helps you fill in the gaps of Medicare, that's $217 a month, totaling $442 a month. And if you choose to get Medicare Advantage over Medigap and get $0 premiums, in the short term you might save money, but in the long term you could end up with many high out-of-pocket costs that it doesn't cover. Now, if you are at retirement age, navigating Medicare can be a very difficult process. And right now, between October 15th and December 7th is open enrollment period. Which is why I'm excited to talk about today's sponsor, Chapter Medicare Advisors. Now obviously, I am not old enough to be on Medicare, but after doing the extensive research on this topic, I understand it can be a very overwhelming process where it's hard to know where to start or even who to trust. In fact, the Department of Justice filed a massive fraud complaint against 3 of the largest Medicare brokers in the country that misled seniors, steering them to insurance plans that paid the highest kickbacks. They weren't given the best plans, but the most profitable ones. Chapter was founded by people whose parents were scammed and vowed to fix the system. Chapter is a fully independent Medicare advisor that advocates for you, not the insurance company. They're the only national advisors that search every Medicare plan available to find the one that best fits your needs. They will walk you through a no-pressure process, exploring different plans, making sure your doctors are covered, and checking to see if you qualify for extra benefits. Chapter is a free resource and has saved the average senior $1,000 a year. So if you need free, unbiased help with Medicare this open enrollment period, consider giving Chapter a call at the number on the screen. By calling that number, you will be connected to a real licensed expert that can help you navigate the process. Again, it's free to use, and by calling that number, it helps support this channel. And so now let's continue on with our story, with the Medicare myth. But even after paying these high premiums, many retirees are surprised to learn that it still comes with many out-of-pocket costs that add up very quickly. However, Medicare only covers people over 65, and many boomers find themselves desperately in need of health care long before they're eligible. Chapter 4, the early retirement shock. The truth about the world we live in is that once you hit your mid-50s, you become a lot less desirable in the workforce, and many boomers are being pushed out of their jobs in their late 50s or early 60s, years before they can qualify for Medicare, which leaves them in a dangerous gap with no coverage. Which poses a big problem because most people over 50 need health insurance. They're managing chronic conditions, taking medication, and seeing specialists. And so because they can't get Medicare, they're forced to seek out their own private health insurance. And I can speak on this subject because I am self-employed and I have to get my own health insurance. And right now in the open enrollment period, this is the cheapest plan I'm offered, $470 a month with a $10,600 deductible. And that is for a 32-year-old that doesn't smoke, rarely drinks, takes no medication, is active, and has no family history of diseases. If that is the cost for a 32-year-old with no needs, imagine the cost for a 60-year-old with many needs. And what often happens when people are in this situation is they get forced to take on Social Security early. In fact, according to Fidelity, 1 out of 3 of early retirees who claim Social Security at 62 do so to help pay for their health care expenses until they're eligible. And because they take it on earlier, they are forced to be at a lower income for the rest of their lives. For example, at 67, you get full Social Security, which on average is about $2,000 a month. But if you take on Social Security at 62, you get 30% less, which is $1,400. They start getting squeezed at the start, and by the time they reach 65, when they're eligible for Medicare, it doesn't get any easier. Chapter 5, the middle class medical squeeze. For many boomers, getting on Medicare should feel like a relief, but oftentimes it marks the beginning of a new financial pressure. And so let's start this chapter off with some math. If you claim Social Security at 62, the median check is about $1,400 a month. The median boomer has $200,000 saved for retirement, which is $650 a month. So they have a total monthly income of $2,050. Let's subtract Medicare premiums, which might be around $375 a month. That leaves you with $1,675 to cover all your living expenses. And maybe if you have a paid off home and car, you can make it work. However, that is still a very tight budget. You're not going to be able to do things like take vacations. You'll always be on a tight budget, and you'll always be waiting for the next Social Security check. But wait, there's more. That $375 a month premium doesn't mean you're home free, but many seniors need far more coverage that Medicare doesn't cover, and these add up very quickly. Like Part D, dental, vision, and some surprise uncovered expenses that come up every month that continue to lower their monthly income. Their limited income keeps getting smaller, making it hard to make it work in the short term. But in the long term, things look even grimmer because healthcare inflation beats cost of living adjustments by a landslide. For example, in 2024, Social Security benefits increased by 3.2% as a cost of living adjustment, but Medicare Part D increased by 6%. Some medications went up by 10%, and Medigap might increase 8% a year. Healthcare inflation is outpacing the cost of living, but the biggest pressure point often isn't the monthly premiums or deductibles, it's prescription drugs. Chapter 6, the prescription drug trap. Perhaps one of the biggest reasons people are living longer is because they're on a bunch of different medications. According to some sources, the average senior takes 4 different drugs daily. These are not just temporary drugs, but these are drugs that you have to stay on for the rest of your lives. And even if you have Part D coverage or prescription drugs, it doesn't cover everything. It still comes with deductibles, copays, and uncovered drugs, which can add up to over $1,000 in expenses in an already tight budget. And also, being on these medications often means more doctor's visits, more tests, and more follow-ups, adding more bills into your retirement. And these medical costs don't just affect individuals, but they affect entire households. And if one spouse gets sick, it can be the collapse of the entire couple's retirement plan. Chapter 7, the spousal spin down. So far in this video, I've approached this topic from the lens of a single person. However, about 50% of retirees will retire with a partner. And this can be a double-edged sword, because on one hand, you get 2 Social Security checks and perhaps 2 401ks, but you have just 1 mortgage, 1 set of utilities, 1 grocery bill, and 1 household to maintain, whereas a single person has to do it all alone. In many ways, retiring as a couple is far cheaper and more stable than retiring as an individual. However, that stability disappears the moment one spouse gets sick. For example, I knew this couple that prepared very well for retirement. They had a nice house on the lake, paid off cars and savings, and then the husband started to have serious heart problems. And all of a sudden, their lives changed. Medical bills started to pile up. They had to sell their lake house and move to a smaller place. And they started to burn through their 401ks to pay for medical bills. And eventually he passed away, but the surviving spouse was left with no savings, no assets, and had to keep working until she was 75. You never know when your health will turn, and in a 2-person household, when one member gets sick, it could affect both of their retirement plans, and then they're left with a bunch of debt. Chapter 8, when healthcare turns into debt. In the United States, 4 out of 10 people have medical debt, and for people over 65, 2 out of 10 people have some form of medical debt. And as we've discussed in this video, Medicare is not this free socialized healthcare for seniors, but it comes with high premiums, deductibles, and many things that are not covered. And when people are on a limited income, these medical expenses can quickly turn into debt that can pile up. Retirees can get in this vicious circle of putting medical bills on their credit cards, falling behind on bills, and borrowing against their 401ks. And once they fall into this cycle, it becomes incredibly hard to climb out of it because they're on such a low limited income, and that debt can again create health problems. They delay appointments, skip medications, and avoid follow-up visits to save money, but that usually leads to bigger problems, emergency room visits, hospitalizations, and even more bills. However, all of this is nothing in comparison to the final cost waiting down the road at the end of many people's life, the one expense that nobody wants to touch. Chapter 9, the long-term care ticking time bomb. As I said in the beginning of this video, according to Fidelity, a single person retiring at age 65 in 2025 will need $172,500 for healthcare costs throughout their retirement. However, that does not include the biggest expense that people will have if they enter old age, and that is long-term care. According to the U.S. Department of Health and Human Services, 70% of Americans over 65 will need some form of long-term care in their lifetime. And Medicare does not cover this expense, and trying to cover it on your own is damn near impossible. A nursing home costs anywhere between $6,000 to $10,000 a month. Assisted living costs between $4,000 to $6,000 a month, and memory care costs between $6,000 to $9,000 a month. I genuinely don't understand how anybody is expected to prepare for an expense like that. It's unrealistic. The only way out is to get Uncle Sam to pay for it through Medicaid. But there's a catch. The government doesn't just give it to you automatically, but many states require that you lower your countable assets down to just a couple $1,000s. And in many cases, people end up selling their cars, draining their 401ks, cashing out life insurance, and spending everything they have in order to qualify, which is called a Medicaid spend down. And over 60% of nursing home residents are on Medicaid. You spend down everything you have until you are essentially broke and living in poverty, and then you will qualify for Medicaid. And that is the not so happy ending that millions of boomers will face at the end of their life, living in poverty and having nothing left to pass to their family. And so I want to finish this video off with Chapter 10, Where Do We Go From Here? Alright, another deep dive story in the books. Every time I research one of these topics, I never know what the story will be, but I spend 2 to 3 days of researching and I eventually find a story. And the more I research retirement, as that is the topic that it seems that you guys want me to talk about, the more I see how unfeasible it is for the average person. Retirement worked okay when it was 5 to 10 years, but now that it's 20 to 30 years, it's just not realistic. And so as we wrap up yet another great video essay, as the student of the topic, I want to share my personal 3 takeaways that I learned making this video. 1. Most people will not be able to work for 40 years and retire for 30. The more I research retirement, the more I see that the reality is most people will not be able to work for 40 years and retire for 30. The math just doesn't work. Life is hard and most people aren't able to save at rates that high. But even if they could, that savings would need to weather decades of rising healthcare costs, inflation, and longer lifespans. The boomers are really the guinea pigs to this DIY retirement, and I think over the next few decades, we're gonna see how unsustainable this system is. And as other generations start entering retirement, I think we're gonna have so many problems, and it's gonna be interesting to see what ends up happening. 2. Our private healthcare system is beyond broken. Whenever COVID happened, I thought that there was going to be this big push where everyone comes together and demands a more socialized healthcare system like the rest of the developed world. But shortly I realized that's not going to happen. And after COVID, I am convinced it is never going to happen. In my opinion, there are certain industries that should never be for profit, but should be for the greater good, like education, public safety, and healthcare. But hey, in America, we would rather take the crumbs away from the poor so that we could give trillion-dollar tax breaks to the rich. The moment you start putting profit on basic human needs is the moment that everybody loses. And finally, staying healthy is a financial strategy, and it takes a lifetime. If there's one thing that I'm learning and seeing as I'm entering my 30s, it is that health is not something that happens on its own, but it's something you have to work on for your entire life. I think that once you enter your 30s, people go down 2 paths. Some people stay active and eat healthy, while others stay sedentary and continue to eat garbage. And throughout their lives, these habits compound. Diet and exercise don't guarantee good health, but they are a key ingredient to living a rich life, and the path that you choose to make could drastically impact how your retirement plays out. Thank you so much for watching. If you enjoyed this video, please give it a like, subscribe for more videos like it, and if you want to hear another very interesting story about why boomers are leaving America in search for a better life, give this video a watch next. And with that, muchas gracias, que tengan un buen día, nos vemos chicos.